relationship to the collecting system. Dual energy CT has been applied and validated for renal mass evaluation. Advantages of dual energy CT are that it could further characterize indeterminate masses detected at single-phase enhanced CT. It's better correcting beam hardening artifact, so it could potentially decrease pseudo-enhancement in small renal lesions, and it may be more sensitive to iodine. Although there are a whole host of disadvantages with dual energy CT, primarily relating to its relative novelty and lack of standardization between vendors, systems, and institutions. Here's an example of how dual energy CT can help in the characterization of an indeterminate hyperattenuating lesion detected at single-phase portal venous phase enhanced CT. We can see that in the interpolar region of the left kidney, there's a 41 Hounsfield unit homogeneous lesion, which could be a hyperdense cyst or a renal cell carcinoma. And typically what we would need to do is call the patient back for a dedicated renal mass CT, MRI, or ultrasound. In this case, the patient happened to have been imaged with dual energy CT, and we can see that on the iodine overlay image, there is no iodine within the lesion, which we confidently diagnosed as a hyperdense cyst and which was confirmed at a subsequent targeted ultrasound. Here's another example of a patient who underwent MRI for characterization of an indeterminate lesion on ultrasound. We can see that there is a T2 hypointense mass in the interpolar region of the left kidney, which has marked restricted diffusion. The lesion is slightly hyperintense on T1, and on the subtraction image, it appears to be enhancing, although we can see that there's significant motion artifact which compromises the subtraction. The patient underwent a renal mass protocol CT, which shows a 17 Hounsfield unit increase in attenuation, which is in the indeterminate range. This happened to be a dual energy CT, and we can see that on the iodine overlay image, there's no iodine within the lesion. So we favored, though we could not reliably diagnose, a hyperdense cyst, and this lesion remains stable on follow-up for 3 years. Other potential applications of dual energy CT are a slightly higher sensitivity for iodine. As we can see on the top panel, we have a low enhancing papillary renal cell carcinoma, which does not enhance by greater than 20 Hounsfield units, but which shows a significant amount of iodine on the iodine overlay image, both subjectively and quantitatively, and a diagnosis of papillary RCC was confirmed at biopsy. Other authors have investigated the ability of iodine overlay images and iodine concentration to differentiate between clear cell and papillary renal cell carcinoma, and we can see on the bottom panel an avidly enhancing mass in the right kidney, which shows a very high iodine concentration, much higher than on the top panel, and this was diagnosed as a clear cell renal cell carcinoma after partial nephrectomy. One pitfall with dual energy CT is to not rely exclusively on the iodine overlay image to diagnose enhancement, because some hyperattenuating cysts may appear to contain iodine on the iodine overlay image. We can see here there is a patient who underwent an ultrasound showing an indeterminate nodule in the interpolar region of the left kidney. The patient underwent a dual energy CT renal mass protocol, and I've provided the iodine overlay image, which shows hyperdensity or increased uptake of iodine apparently within the lesion, which could be diagnosed as an enhancing renal cell carcinoma or other solid lesion. But we can see that when we review the trace images, when we compare the true unenhanced CT to the true portal venous phase enhanced CT, there is no enhancement within the lesion, which is greater than 70 Hounsfield unit at unenhanced CT. So this is an example of a pitfall of dual energy CT, which may falsely characterize hyperattenuating cysts as enhancing on iodine overlay images. Moving on to MRI, I've